Hashimoto's thyroiditis, also known as chronic lymphocytic thyroiditis, is an autoimmune disorder that primarily affects the thyroid gland. It is one of the most common thyroid diseases, particularly in women. In this script, we will delve into various aspects of Hashimoto's thyroiditis, exploring its immunogenetics, environmental factors, diagnostic imaging techniques, emerging biomarkers, and much more. Hashimoto's thyroiditis is characterized by the presence of specific autoantibodies against thyroid antigens, mainly thyroid peroxidase, TPO, and thyroglobulin, TG. Genetic factors play a significant role in the development of Hashimoto's thyroiditis, with certain human leukocyte antigen, HLA, alleles, such as HLA-DR3 and HLA-DR5, being associated with an increased risk. Understanding the immunogenetics of this condition can help in its early diagnosis and management. Iodine is an essential nutrient for thyroid hormone synthesis. However, excessive iodine intake has been suggested as a potential risk factor for Hashimoto's thyroiditis, particularly in individuals with underlying genetic susceptibility. We will discuss the intricate relationship between iodine intake and the development of this autoimmune disorder. Epigenetic modifications, such as DNA methylation and histone acetylation, have been implicated in the pathogenesis of Hashimoto's thyroiditis. The interplay between genetic and epigenetic factors can significantly impact disease susceptibility and progression. We will explore the epigenetic mechanisms involved in thyroid autoimmunity and their potential therapeutic implications. Hashimoto's thyroiditis is characterized by an infiltration of lymphocytes into the thyroid gland, leading to progressive destruction of thyroid follicles. We will delve into the intricate cellular and molecular mechanisms underlying this autoimmune destruction, including the role of T and B lymphocytes, cytokines, and other immune cells. Patients with Hashimoto's thyroiditis often have an increased risk of developing other autoimmune diseases, such as rheumatoid arthritis, type 1 diabetes, and Sjögren's syndrome. We will explore the underlying mechanisms that contribute to the co-occurrence of these autoimmune comorbidities and the clinical implications for patient management. Hashimoto's thyroiditis is an autoimmune disease in which the body's immune system mistakenly attacks the thyroid gland. This results in chronic inflammation and eventual destruction of the thyroid tissue. Although there is no permanent cure for this condition, several pharmacotherapy options can effectively manage the symptoms and prevent further damage to the thyroid. One of the main approaches in the treatment of Hashimoto's thyroiditis is thyroid hormone replacement therapy. Since the immune system attacks and damages the thyroid, it cannot produce enough of the essential thyroid hormones, namely thyroxine, T4, and triiodothyronine, T3. Therefore, the administration of synthetic thyroid hormone medication, such as levothyroxine, is necessary to restore the hormonal balance in individuals with this condition. By replacing the deficient thyroid hormones, patients can alleviate the symptoms associated with an underactive thyroid, such as fatigue, weight gain, and cold intolerance. In cases where inflammation and autoimmunity are more severe, immunosuppressive agents may be prescribed. These medications work by suppressing the overactive immune response and reducing the inflammation in the thyroid gland. Glucocorticoids, such as prednisone, can be used to dampen the immune system's attack on the thyroid and alleviate symptoms. Recent research has also explored novel targeted therapies for the treatment of Hashimoto's thyroiditis. These therapies aim to specifically target and regulate the immune system components involved in the autoimmune attack on the thyroid gland. For instance, certain monoclonal antibodies, such as rituximab, have shown promise in reducing thyroid inflammation and improving thyroid function in some individuals. In summary, pharmacotherapy options for managing Hashimoto's thyroiditis include thyroid hormone replacement therapy, immunosuppressive agents, and emerging targeted therapies. These treatment approaches effectively manage symptoms, restore thyroid hormonal balance, and slow down the progression of this autoimmune condition. However, it is essential to consult a healthcare professional for appropriate diagnosis and personalized treatment recommendations based on each patient's specific needs. Hashimoto's thyroiditis is an autoimmune disorder that affects the thyroid gland. Recent research suggests that environmental factors may play a role in the development of this condition. Exposure to certain chemicals, such as pesticides and industrial pollutants, has been associated with an increased risk of Hashimoto's thyroiditis. Additionally, viral infections and dietary factors, such as iodine intake and gluten sensitivity, have also been linked to the development and progression of the disease. Understanding these environmental triggers may help us develop strategies to prevent and manage Hashimoto's thyroiditis more effectively. In order to accurately diagnose and monitor Hashimoto's thyroiditis, it is crucial to utilize advanced imaging techniques. These techniques allow clinicians to assess the morphology, vascularity, and function of the thyroid gland in patients with this condition. Ultrasound, scintigraphy, and other imaging modalities are commonly employed to evaluate the affected thyroid gland. These imaging studies provide valuable information for determining the extent of inflammation and damage to the thyroid gland, aiding in the diagnosis and management of Hashimoto's thyroiditis. Hashimoto's thyroiditis, a thyroid disorder, can have serious consequences if not detected and monitored early. To facilitate timely intervention and prevent long-term complications, researchers have been studying new biomarkers. These biomarkers include microRNAs, which are small RNA molecules that regulate gene expression, thyroid autoantibodies, which are antibodies that target the thyroid gland, and immune cell subsets, which refer to different types of immune cells. By analyzing these biomarkers, doctors hope to improve the accuracy of diagnosis and predict the progression of the disease. In the context of Hashimoto's thyroiditis, it is important to understand the impact of dietary factors on the disease. Nutritional deficiencies can potentially contribute to the development and progression of this autoimmune disorder. Additionally, gluten sensitivity and the importance of selenium supplementation will be explored in terms of their potential benefits for managing Hashimoto's thyroiditis. These dietary interventions have been suggested as potential strategies to improve the clinical outcomes of individuals with this condition. Hashimoto's encephalopathy is a complex condition that occurs in a small number of individuals with Hashimoto's thyroiditis. It is characterized by neurological symptoms that can be disabling. This video will provide an in-depth look at the various clinical features of Hashimoto's encephalopathy, the underlying mechanisms involved, the difficulties in diagnosing this condition, and the available treatment options. Understanding these aspects is crucial for medical professionals in order to properly identify and manage this intriguing complication. Hashimoto's thyroiditis can have implications for both the mother and the developing fetus during pregnancy. We will discuss the effects of maternal thyroid antibodies on reproductive health, fetal development, and the risk of miscarriage and preterm birth. Additionally, we will explore optimal management strategies for pregnant women with Hashimoto's thyroiditis. In this comprehensive script, we have delved into various aspects of Hashimoto's thyroiditis, ranging from its immunogenetics to its environmental triggers, diagnostic approaches, and management options. By understanding the complex interplay between genetic, environmental, and immune factors, we can improve the diagnosis, treatment, and overall outcomes for patients with Hashimoto's thyroiditis.